So in previous classes we discussed about cholinergic drugs, the drugs which increases the activity of acetylcholine. Okay. So in today's class, let us try to learn about anticholinergic drugs or anticholinergic agents. Okay. So to understand today's topic, let me revise some basic things because uh, after a long time we are restarting the lectures and many new students also joined today. See, first of all, we all know that in acetylcholine we have five types of receptors, right? In acetylcholine or cholinergic receptors we have five types. In that we have M1. M1 receptor is located in gastric glands. M1 receptors are located in gastric glands. Okay. And M1 receptors are also located on autonomic ganglia. Autonomic ganglia. We have already seen what is autonomic ganglia, what is synapse, what is neuromuscular junction. Okay. And the third location of M1 receptor is central nervous system. All these points we have already discussed in previous classes. I'm just revising because if you understand the locations of all these receptors, it will be easy for us to understand. Okay. So M1 receptors are located on gastric glands. They are located on autonomic ganglia and also in central nervous system. Now you see, when M1 receptor is stimulated, M1 receptor is stimulated by acetylcholine or cholinergic drugs. In last class we have seen. Okay. So when M1 receptor is stimulated, what happens? It will increase all gastric secretions. That means it will increase the secretions of gastric hormones. It will increase acid secretion, HCl, from the parietal cells. Okay. And it also causes peristaltic movement. Actually peristaltic movement is caused due to M3 receptors. Anyways, M1 receptor activate हुआ तो क्या होगा? It will increase all gastric hormones. And on autonomic ganglia it has wide variety of uses, and in CNS system it increases the uh, cognitive power. Okay, it increases cognitive power. Cognitive power means it increases memory power. So this is about M1 receptors. And now we also have M2 receptors. In cholinergic nervous system we have M2 receptors. M2 receptors are present directly on heart. On heart, if M2 receptor is stimulated, it will show three actions. On heart, if M2 receptor is stimulated, it will show three actions. Number one, let me explain you. It will cause negative chronotropic effect. Negative chronotropic effect receptor. When M2 receptor is stimulated on the heart, it shows three actions. Number one, it causes negative chronotropic effect. It causes negative ionotropic effect. Ionotropic effect. And it also causes negative ड्रोमोट्रोपिक इफेक्ट. ड्रोमोट्रोपिक इफेक्ट. सब लोग ध्यान से सुनो. सी, when M2 receptors are activated on heart, M2 receptors are activated by acetylcholine or cholinergic drugs. Okay, when M2 receptors are activated, it will show three actions. Number one, negative chronotropic effect. Chronotropic effect means heart rate. Negative chronotropic effect means when M2 receptor is stimulated, heart rate decreases. What is positive chronotropic effect? What is positive chronotropic effect? Yes, positive chronotropic effect means it increases heart rate, and heart rate is increased by adrenaline. That one we will discuss later. Now we are discussing about M2 receptors. When M2 receptors are activated, first action, it shows negative chronotropic effect. Negative chronotropic effect means it decreases heart rate. Negative inotropic effect means it decreases force of contraction of heart. Force of contraction of heart. You have to remember this. And negative dronotropic effect means AV conduction velocity. AV conduction velocity will be decreased. Okay, so these three actions are mediated by M2 receptors. When M2 receptors are activated, it will show these three actions. I think you understood what actions are mediated by M1 and M2. Okay, and we have M3. M3 receptors are located in different places. ध्यान से सुनो सब लोग. M3 receptors are located on smooth muscles. They are located on exocrine glands, and they are also located on endothelial cells of what? Blood vessel. See, this is blood vessel. We have endothelial cells in the blood vessel. So in these blood vessels we have M3 receptors. Okay, when M3 receptors in blood vessel endothelial cells are stimulated, it will release nitric oxide, and it will cause vasodilation. So M3 receptors on endothelial cells, it causes vasodilation. M3 receptors on exocrine glands. On exocrine glands, where do we have exocrine glands? We have salivary gland, we have lacrimal gland, we have sweat gland, we have bronchial glands. I mean, in the bronchioles we have mucus glands which will release mucus, and also in the gastric glands. So exocrine glands are present in all these glands. So when M3 receptor is stimulated, it will release all exocrine secretions. It will cause salivation, more saliva is produced. It will stimulate lacrimation, more tears are produced. It will stimulate sweat glands, more sweat is produced, and in bronchioles it will increase the production of bronchial secretions, and in gastric it will secrete all gastric secretions. So this is the action of M3 receptors on exocrine glands. And on smooth muscles, we have three types of smooth muscles. M3 receptors are located on three types of smooth muscles. Number one, in the GI tract. In the GI tract, we have smooth muscles. In the urinary bladder, ध्यान से सुनो, urinary bladder, we have smooth muscles, and we also have smooth muscles in bronchioles. Okay. See, M3 receptors are present in the smooth muscles of GI tract. M3 receptor, when it is activated in GI tract, it increases peristaltic movement. Through that, what it does, it will cause increased gastric emptying time, and it causes diarrhea or defecation. And on urinary bladder, just imagine this is urinary bladder, this is kidney, this is ureter, and this is urinary bladder. Urinary bladder is connected with urethra. Okay, so this urinary bladder has smooth muscles, trigonal smooth muscles bolte. Urinary bladder has smooth muscles. When M3 receptor in these urinary bladder are stimulated, it will cause constriction of urinary smooth muscles, and it relaxes the sphincter of bladder, and through that, what it does, it will help in excretion of urine, or it will cause urination. Are you all following me? Yes, all these points we have already discussed. I am just revising you. Okay, so smooth muscles, GI tract में है. In GI tract it causes diarrhea, it increases peristaltic movement. In urinary bladder it increases urination by contracting urinary trigonal smooth muscles. And on bronchioles also we have smooth muscles. When M3 receptors are activated on bronchioles, it causes bronchoconstriction. I think you all understood the actions of M3 receptors of acetylcholine. Clear? Now we will see actions of M4 and M5 receptors. Now we also have M4 and M5 receptors. M4 and M5 receptors are mainly located in central nervous system. When M4 and M5 receptors are activated, it may increase stimulation or CNS stimulation, and simply it will cause cognitive power. Memory power badega. Okay, so this is the main action of M4 and M5 receptors in central nervous system. So far what we have seen, we have discussed about cholinergic receptors, especially cholinergic muscarinic receptors. In muscarinic receptors, we have M1, M2, M3, M4 and M5. Okay, their locations we have seen, and their actions also we have seen. Clear? Now in today's topic, we will discuss about anticholinergic drugs. Anticholinergic drugs means the drugs which will stop the actions of acetylcholine on muscarinic receptors. Actually, along with muscarinic receptors, we also have nicotinic receptors N and NM. So anticholinergic drugs are the drugs which will act against acetylcholine on muscarinic receptors, and anticholinergic drugs are also those drugs which will act against acetylcholine on nicotinic receptors. Okay, the drugs which will act against muscarinic or nicotinic receptors, or the drugs which will block the actions of muscarinic and nicotinic receptors, are called anticholinergic drugs. Clear, everybody? Clear? See, in anticholinergic drugs we have antimuscarinics and antinicotinics. In anticholinergic drugs means the drugs which will act or which will decrease the actions of acetylcholine. Okay, in that we have antimuscarinic. Antimuscarinic drugs are those drugs which will block the actions of muscarinic receptors, and antinicotinic drugs are those drugs which will block the actions of nicotinic receptors. So in nicotinic receptors, what we have NN nicotinic receptor and NM nicotinic receptors. So the drugs which will block NN receptors are called ganglionic blockers or NN blockers, and the drugs which will block NM receptors are called NM blockers, or simply neuromuscular blockers, because NN receptor is mainly present on the ganglia and NM receptor is mainly present in the neuromuscular junction. So In anticholinergic drugs, we have two types: antimuscarinic and anti-nicotinic. Okay, you should not confuse these terms. In anticholinergic drugs, particularly, we focus on antimuscarinic drugs only. Anticholinergic means antimuscarinic, because anti-nicotinic drugs in hospitals we don't have much uses high but very rare. Okay, so let me try to classify classification of antimuscarinic drugs. Antimuscarinic drugs. Antimuscarinic drugs means the drugs which will act against muscarinic receptors. See, ध्यान से सुनो सब लोग, this classification is very very important. In antimuscarinic drugs, we have three classes. Number one, we have natural alkaloids. In antimuscarinic drugs, the first we have three types actually. Number one is antimuscarinic, natural alkaloids. Number two, we have semisynthetic. Semisynthetic. Okay, and the third one we have synthetic. Synthetic means directly they are synthesized. So in antimuscarinics we have natural, semisynthetic and synthetic. See, in natural alkaloids we have two types, I mean two examples. Number one, we have atropine, very very important. Second one, we have scopolamine. Scopolamine. ध्यान से सुनो, atropine is derived from Atropa belladonna plant. Atropa belladonna. It is also called belladonna alkaloid. Atropine is also called belladonna alkaloid. It is obtained from Atropa belladonna plants. Okay, and scopolamine is another natural alkaloid which is an anti-muscarinic agent. This scopolamine is also called hyoscine. You might have heard about hyoscine. SCINE, hyoscine. Scopolamine is also called hyoscine, the other name of scopolamine, and this scopolamine is obtained from Hyoscamus niger plant. So these scopolamine and atropine are naturally occurring alkaloids. They are directly obtained from plants. Atropine is derived from Atropa belladonna and scopolamine is derived from Hyoscamus niger. Okay, and in semisynthetic we have some examples. In semisynthetic we have hyoscine butyl bromide, which is the semisynthetic form of hyoscine. Simply hyoscine में थोड़ा बहुत changes करें तो क्या होगा? We have hyoscine butyl bromide. Hyoscine butyl bromide is one in semisynthetic, and second one we have Homatropine. Have you heard about Homatropine? It's Homatropine. सुने नाम Homatropine. And in third one we have ipratropium bromide. Ipratropium bromide and tiotropium bromide. Very 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 important drugs. Tiotropium bromide. Are you all following me? In third classification of antimuscarinic drugs, we have synthetic agents. Synthetic agents means they are directly synthesized from the laboratories. They are not obtained directly from plants. Okay, here semisynthetic means they are obtained from plants, and from the plant's active agent we make some modification. Okay, some functional groups will be changed, so they are called semisynthetic forms. Okay, so in synthetic we have so many examples. Sab log here, these synthetic forms are very widely used in hospitals. So in synthetic forms, let me classify with therapeutic class. Okay, I will try to classify the synthetic form of antimuscarinic drugs. Okay, in synthetic form of antimuscarinic drugs, ध्यान से सुनो. I think my screen is visible to you all. अगर आपको बराबर नहीं दिख रहा है तो you can just zoom out. Okay, zoom in कर सकते हैं आप if my writing is not visible. Now you see, in synthetic form of first type of antimuscarinic drugs in synthetic form is cursor के हाँ, we have mydriatic drugs. Mydriatics. We have cyclopentolate. Next we have tropicamide. Have you heard about tropicamide? You have to write all this while listening, so that you will feel that somewhere you have heard about the drug. Okay, cyclopentolate and tropicamide are the drugs which are used as mydriatics. Mydriatics means they are used to increase the pupillar size of the eyes. Okay, in meiosis we use this. Number 2, in synthetic in number 2 we have drugs which are used for peptic ulceration. Anticholinergic drugs or antimuscarinic drugs which are used in peptic ulcer or pirenzepine. Pirenzepine, ध्यान से सुनो, pirenzepine. We have tolenzepine. Tolenzepine. We have clidinium. Clidinium, ध्यान से सुनो. And we have propantheline. 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 Okay. Anticholinergic drugs or antimuscarinic drugs which are used in peptic ulcer or pirenzepine, tolenzepine, clidinium and propantheline. So these drugs are used for peptic ulceration. Actually in previous days these anticholinergic drugs were used very commonly, but nowadays we are not using. We have proton pump inhibitors, we have anti H pylori drugs, antibacterial drugs, we have antacids, both side drugs are effective drugs. So we are not using these, but in classification we have to study. And the third class of antimuscarinic synthetic agents are antispasmodics. Very, very important. Antispasmodics. Antispasmodics are the drugs which will decrease the abdominal pain or abdominal cramps. Okay, skeletal muscle या smooth muscle spasms will cause pain. Smooth muscle spasm, skeletal muscle spasm. Spasm means severe contraction, so they will cause pain. Muscle sprain बोलते, muscle spasm बोलते. So if anybody has muscle spasm or muscle pain, they will cause severe what we can say intolerance, or patient will have lethal consequences. So in that case we have antispasmodics. Antispasmodics are the drugs which will relax the muscle contraction. In that we have dicyclomine, very, very important drug. Dicyclomine. We have valethamate. Have you heard about valethamate? Valethamate. We have flavoxate. Oxybutynin. And we also have dariphenacin, tolterodine, both are drugs. In that dicyclomine is very, very important. Dicyclomine is the drug which is under antispasmodics, which is coming in synthetic form of antimuscarinic drug. Okay, so this is the third class of synthetic form of antimuscarinic drugs. And we have the fourth class of synthetic form of antimuscarinics. We have pre-anesthetic agent. Pre-anesthetic agent means the drug which is given before anesthesia is given. In that glycopyrrolate, very, very important drug. Pyrrolate, glycopyrrolate. And fifth class of synthetic anti-muscarinic drug is drugs used in Parkinsonism. Parkinsonism में anticholinergic drugs are used along with other anti-Parkinsonism drugs. Anticholinergic drugs are also used. यहाँ पे anticholinergic anti-Parkinsonism drugs are benzhexol, benztropine, and bipyridine. And see, just try to remember, these drugs will cross central nervous system, BBB, and they will act in brain. They have to act in brain only, no? In Parkinsonism we have dopamine receptor or dopamine deficiency, so they will decrease the actions of Parkinson symptoms, like patient will be having tremors, patient will be having movements, all those symptoms will be decreased. So benzhexol, just remember it as BBB, blood brain barrier. They will enter into the brain and they'll cause anti-Parkinsonism actions. So these are anticholinergic drugs which are used in Parkinsonism. So these are synthetic forms of drugs. They are used as mydriatics. They will increase the pupil size, which is called mydriasis or mydriatics. In that we have cyclopentolate and tropicamide. We have drugs, anticholinergic drugs which are used in peptic ulcer. We have pirenzepine, telenzepine, clidinium and propantheline. And antispasmodics, dicyclomine is very important. And we also have some drugs which are used as pre-anesthetic agents. In that glycopyrrolate is very important. And anti-Parkinsonism, BBB. Okay, so these are the classifications of antimuscarinic drugs. In antimuscarinic drugs we have discussed three classes. Number 1, we have natural alkaloids, atropine and scopolamine. We have semisynthetic, In that we have three examples. In this, remember, ipratropium bromide and tiotropium bromide as we are very very important. And we have synthetic forms in synthetic, mydriatics, peptic ulcer, antipeptic ulcer drugs, antiparkinsonism, antispasmodics, and pre-anesthetic agents. Okay, so these are the examples of antimuscarinic agents. I think this ड्रग क्लासिफिकेशन इज क्लियर टू यू ऑल. इसमें क्लासिफिकेशन में यू हैव टू मेमोराइज, इसमें कुछ भी नहीं है, पढ़ाने का कुछ नहीं है. नाउ यू सी, नाउ लेट अस ट्राई टू अंडरस्टैंड अबाउट atropine. Atropine is the first drug which is a natural alkaloid, right? Atropine is a very very strong anticholinergic drug or strongest antimuscarinic agent. Atropine is very strong anti muscarinic agent. That means, see, we have M1, M2, M3, M4, M5. We have 5 types of muscarinic receptors, right? So this atropine, what it does, atropine will go and it will bind on this M muscarinic receptors, and it will stop or it will decrease the actions of acetylcholine. Okay, atropine will decrease the actions of acetylcholine, which is mediated through muscarinic receptors. So atropine is a strong anti-muscarinic drug, or simply we can say atropine is a anticholinergic drug. Okay, strong anticholinergic drug, because it is decreasing the actions of acetylcholine. Atropine is available as injection form, very very important. It is used as parenteral. It is usually given in IM as well as infusion, and it is also available as topical solution, which is used in eyes as topical agent. Okay, eye drops. And sometimes atropine tablets are also available. But tablets are mainly used in animals. You know, atropine can also be used in animals because sometimes animals will have diarrhea. Cattle, cow, buffalo and all, in animals also sometimes they will have infection, and due to gastric infections they'll have diarrhea. So in that, atropine is used. What is the action of atropine? In GI tract? That I'll explain now. Okay, so atropine is strong antimuscarinic agent, and these are the different formulations of atropine. Now let us try to discuss in detail about atropine. Usually atropine, yeah, this is the tablet form of atropine. Usually it is available in combination form. Atropine is combined with metronidazole. Metronidazole is imidazole type of antibiotic. Okay, it is mainly, metronidazole is mainly used as anti-parasitic agent as well as antibacterial agent. Okay, usually metronidazole is very very effective for gastric related infections, and especially in anaerobic bacteria, gastric intestinal bacteria. All intestinal bacteria are anaerobic bacteria. So in those anaerobic bacteria, metronidazole is very effective. Even in our body also, metronidazole is effective for bacteria as well as parasitic infections like amoebiasis. In that conditions also it is very effective. And metronidazole 1 gram, and furazolidone 500 mg, and here atropine is also mixed with this drug. Atropine has anti-secretory as well as anti-paralytic movement. I mean, the gastric motility decreases, and metronidazole is very effective as antibiotic and antimicrobial agent. So through that they will decrease infections in animals. Okay, so in human beings also we can use this, but I don't think the atropine se bhi bahut अच्छे drugs we have, so many other drugs we have. So yes, so you can see the image. This is the Atropa belladonna plant. So from the fruits and from the flowers and from roots also, Atropa belladonna is obtained. Atropine is obtained. So this is the plant. ये plant कहीं भी देखे तो just imagine this is the Atropa belladonna plant. If anybody takes or if anybody tries to eat the fruits, these fruits, कोई अगर इसके fruits खा लिए ना तो क्या होगा, you know? What happens if the fruits of Atropa belladonna is consumed? Anybody from the class? What happens? Cardiac depression. हाँ, का हार्ट रेट बढ़ जाएगा, और constipation. Very good. Simple. See, there is one condition called belladonna poisoning. Belladonna poisoning. What is belladonna poisoning? Belladonna poisoning is nothing but atropine poisoning. Atropine poisoning is nothing but overconsumption or consumption of belladonna plant or atropine, because Atropa belladonna is containing atropine, natural alkaloid. Okay, so Belladonna poisoning के बारे में all clinical presentations and all I'll explain. Just I expected this. Anyways, चलो. So atropine is obtained from this plant, Atropa belladonna. And you know one thing, in previous class I was telling you, Datura plant is having some alkaloids. Datura plant is having some alkaloids. Can anyone tell me the alkaloids which are obtained from Datura plant? Datura plant. Hyoscine. Datura, Hyoscine nigra is Datura plant. See, Datura plant is having some alkaloids which are having very very similar actions like atropine. From that only, from Datura plant only, many scientists tried to develop the atropine. Atropine का discovery कहाँ से शुरू हुआ? Atropine का discovery started from Datura plant only. Okay, because Datura plant is having alkaloids which are having very similar actions like atropine. पुराने जमाने में देते थे. Datura plant extracts were used for asthma. Even atropine also has anti-asthmatic properties that I'll explain now. Okay, now let us try to discuss about the actions of atropine on each and every tissue. With this you will understand in clear what will be the actions of atropine. Number 1, on central nervous system. On central nervous system, atropine has 3 to 4 actions. See, mainly 3 actions. ध्यान से सुनो सब लोग. On each and every system, atropine has very wide variety of functions. See, on central nervous system atropine usually in normal therapeutic doses. जब atropine normal therapeutic doses में देंगे ना तो क्या होगा? It is having mild CNS stimulant effect. Number 1, it is having mild stimulant effect. Along with this, it produces anti-Parkinsonism effect. Okay, by reducing the cholinergic overactivity. Anyways, Parkinsonism के बारे में we'll discuss one day, because in Parkinsonism dopamine activity decreases and cholinergic activity increases. So in Parkinsonism, what we have to do? We have to decrease the cholinergic activity and we have to increase the dopamine activity. So levodopa is given, and along with that, atropine or atropine derivatives also can be given. So this is the first action. On central nervous system, it has mild CNS stimulant action and anti-Parkinsonism action. Okay, and see, this is first action on central nervous system. Second action, it suppresses the vestibular disturbances in ears and it causes anti-motion sickness. How many of you heard about motion sickness? Motion sickness. Whenever we travel in car or in train or in some mountain areas, what happens? We will develop syncope. चक्कर खा के गिर जाते हैं लोग. Syncope. Or sometimes patient will have severe nausea, vomiting, and some people will have GA related distress. So in that, what happens? Patient will have to face many consequences. So atropine has vestibular disturbances suppression action. Actually अपने ear के अंदर जो vestibular है, the stability, the organ which maintains stability, so that organ is suppressed actually, and through that it will have anti-motion sickness activity. So atropine is having anti-motion sickness action. That is second action. And in large doses it will have excitation, over excite हो जाएगा patient, नींद नहीं आएगी, restlessness. अरे आओ जी बैठ जाओ, you just sleep बोले तो no one, they will not sleep, because atropine will cause restlessness, atropine will cause agitation, dance करते रहता, कूदते रहता, patient will be elating. Okay, overactivity हो जाता patient, and it will also cause hallucinations. Very very important. आप देखो belladonna poisoning में, belladonna poisoning is nothing but overdose of atropine, right? In overdose of atropine, CNS stimulant effect, anti-Parkinsonism effect, okay, that is fine, and more anti-motion sickness, that is also fine. But in overdoses, it will cause excitation, restlessness, agitation, and it will cause hallucinations. Once, see, whenever you are in some pilgrim places, or if you are visiting some temples, and if you are very much connected with the god or with the devil, if you consume this belladonna plant, really God will appear to you. God, you can directly see the God. God will come, God will talk to you. God will talk, devil will talk, they will say their problems. They will tell you कि please come and give some money, you save me, ऐसा करके बोलेंगे. Okay, so this type of hallucinations can be seen with belladonna poisoning, and it causes medullary paralysis, coma, and sometimes death also. Belladonna poisoning also can cause death. Very very dangerous condition. So these are the actions of atropine on central nervous system. I think this slide is clear to you all. Next, on cardiovascular system, what will be the actions of atropine on cardiovascular system? Each system के actions very carefully ध्यान रख लो. Okay, see, on cardiovascular system, usually in therapeutic doses, it will cause tachycardia. Just now someone was telling bradycardia, it will cause tachycardia. On therapeutic doses on heart it will cause tachycardia. Usually that is due to the blockade of M2 receptors. Actually, when M2 receptors are blocked, it will cause bradycardia. But here, when M2 receptors are activated, it will cause bradycardia. But when it is blocked, it will cause tachycardia. It is the opposite action of acetylcholine. Acetylcholine का opposite action है. Okay. Anyways, so in high doses it will cause flushing. This is very important point. Very important point. Actually, acetylcholine causes vasodilation. Okay, by releasing nitric oxide from the endothelial cells. Here atropine should cause opposite action, no, it should cause vasoconstriction, no, but no, in higher doses it will cause vasodilation. This thing you have to remember. Okay, very important point. And at low doses atropine causes initial bradycardia. Starting में bradycardia दिखा था and उसके बाद it will cause tachycardia. Okay, so on cardiovascular system it will cause tachycardia and it will cause blood vessel vasodilation. Very important. So this is important point. And sometimes atropine can be used in sinus bradycardia. Yes or no? Atropine can be used in sinus bradycardia. Yes or no? Atropine can be used in sinus bradycardia. Yes or no? Yes, because it is having tachycardia. No, it is increasing heart rate. People are not listening, I think. Next, on the glands. On the glands, what we have? We have salivary glands. We have lacrimal glands. Just now I told. Okay, M3 receptors, exocrine glands, M3 receptors. We have salivary glands. We have lacrimal glands. We have sweat glands. We have mammary glands. Very important. Mammary glands. We have bronchial glands. And we have gastric glands. These are all exocrine glands. See, pancreas also exocrine gland only. Yes, pancreas, acinar cells and duct cells we have pancreas, not islets of Langerhans, the other part, pancreas. And what exocrine glands we have? Sweat glands. Okay, और क्या है, क्या बचा? So all these glands, see, all these glands secretions will be increased by atropine. But remember, you should not think कि atropine will, not atropine, all cholinergic activity, when cholinergic activity increases all secretions will be increased, ऐसा करके नहीं. यहाँ पे mammary glands are not shown any action with atropine as well as with acetylcholine. Okay, इसका action कुछ नहीं रहेगा. So what atropine does here? Atropine will decrease all secretions of exocrine glands. Okay, all exocrine gland secretions will be decreased. That is the exact opposite action of acetylcholine because it is inhibiting M3 receptors. Simple. Clear? So when atropine is given, skin and mucous tissues they will be dried. Mouth dry होते रहता, skin dry होते रहता. Okay, so all these sweat glands, salivary glands, nasal glands, throat, bronchial glands, gastric, lacrimal, all these will be reduced with their secretions. Clear? Now next, on smooth muscles. In smooth muscles we have GI tract, GI smooth muscles. We have bronchial smooth muscles. We have urinary smooth muscles, urinary or bladder smooth muscles. Okay, ध्यान से सुनो सब लोग. Here we have some uses for atropine. See, when atropine is given, it will decrease the peristaltic movement of gastric smooth muscles. It decreases the peristaltic movement and it increases the tone of sphincter. So with this what it does? It is decreasing the peristaltic movement and it is increasing or it is closing the sphincter. With this what will happen? Patient will have constipation. Prajal was telling just now. Yes? When atropine is given, what it does? It will decrease the peristaltic movement in the GI tract and it will increase the sphincter tone or it will close the sphincters of GI tract. With this what will happen? It will cause constipation. Very clear and very simple. And on bronchioles, and in bronchioles, actually acetylcholine was causing bronchoconstriction. But what atropine does? Atropine will cause bronchodilation. This is very important. Atropine will cause bronchodilation. And so actually atropine can be used in some asthma and COPD conditions. Asthma COPD conditions में we can go with atropine. Actually atropine is having atropine is having unspecific actions on many tissues. That's why we don't use. But atropine अगर inhalant form में मिल गया तो we can go with asthma also. And on urinary smooth muscles, bladder smooth muscles. See, same like GI tract, in bladder smooth muscles also, the trigonal smooth muscles of bladder are relaxed. trigonal smooth muscles of bladder are relaxed, and it will constrict the sphincters of bladder. It will constrict, or it will close the sphincter of bladder. With that, what it will cause? It will decrease the urine output, or it will decrease the urination. It will decrease the urination. Okay, so this is the action of atropine on the smooth muscles, on the GI smooth muscles, on the bronchial smooth muscles, and on the urinary smooth muscles. Clear, everybody? These are the actions of atropine. Are you all following me? Are you all following me? Okay, see, it is very easy. I am going very slowly, and each and every point I am explaining. अगर आपको समझ में नहीं आया तो you should ask me. Okay, now you see, let's summarize the actions of atropine. Actions of atropine in single slide. On CNS, what it does? It will control the tremors, and it will show anti-Parkinsonism effect, and it will cause slight CNS stimulant effect. Okay, on the CNS system. And all the secretions are decreased. All the exocrine secretions are decreased. In the GI tract, simply I told, it will cause constipation. On urinary sphincters, or on the urinary system, it will cause urinary retention, or it will decrease urine output. Urine output कम हो गया तो उसको urinary retention ही बोलते हैं ना. Urine will stay in the bladder itself. Urine will not come out of the bladder. Okay, and on bronchioles, it will cause smooth muscle dilation, bronchodilation. So it is useful in asthma. This is the beneficiary effect. बाकी के कुछ भी beneficiary नहीं है. But here in diarrhea we can use, and if anybody has diuresis, or if anybody has uncontrolled bladder, so in that cases also we can give this. So in eyes, actually in eyes it causes mydriasis. Okay, mydriasis. And on heart it causes tachycardia. Initially it causes bradycardia, but actually it will cause tachycardia. याद रख लो. And on blood vessels it will cause vasodilation, same like acetylcholine. So these are the different actions of atropine on different tissues. I think you all understood these actions of atropine. Atropine बोले तो ये सब actions याद आ जाना आपको. These actions are all exactly opposite to acetylcholine. Simple. You all know the muscarinic receptor locations. You also know their actions. So what happens? Atropine will reduce the actions of muscarinic receptors. Simple. Now let us see the pharmacokinetics of atropine. Pharmacokinetics of atropine. See, atropine is available through all the routes. It is absorbed rapidly from the eyes as well as from the oral, and if it is given through IV route में दिया तो its bioavailability is 100%, and it is distributed to all parts of the body. It crosses blood-brain barrier. Very, very important point. Atropine can cross blood-brain barrier. Very, very important point. Protein binding तो अच्छा ही है, ज़्यादा नहीं है, कम नहीं है. It is medium. Okay. It is distributed to all body parts. Okay. Absorption. Next is distribution. It is distributed in all body parts, and next is metabolism. This is important, little bit important. Atropine is not 100% metabolized. It is not 100% metabolized. It is not metabolized 100%. Partially, it is metabolized only partially. Atropine is partially metabolized, and it is excreted. The partial metabolites and partial active form of atropine are excreted through urine. Okay, metabolism 100% नहीं होगा, partially metabolized होगा. Partially metabolized atropine and metabolite product of atropine are excreted through urine. Okay, so this is the pharmacokinetics of atropine. Okay, atropine duration of action depends on the dose. Now you all understood the pharmacokinetics of atropine. इसमें ज़्यादा डिटेल में जाने की ज़रूरत भी नहीं है. Now let us try to see some derivatives of atropine. Atropine derivatives क्या है? Just now we have seen atropine is the natural alkaloid, and remaining all are semisynthetic, and we have synthetic. See here, I'll try to go very fast. यहाँ पे each and every drug के बारे में डिटेल में नहीं पढ़ सकते अभी. These drugs are having specific actions. Just now I was telling you about homatropine. Homatropine is semisynthetic form. Yes, homatropine is the semisynthetic form of antimuscarinic agent. Okay, this is having less potent than atropine. Duration of action is little bit higher. So it is usually used in eye as mydriatic agent. And along with that, as mydriatic agents, already we have cyclopentolate and tropicamide. These are synthetic agents. Okay, they have rapid onset of action, fastest acting, and they are short duration of action than atropine. Okay, action of cyclopentolate lasts for 24 hours. This one you have to remember about cyclopentolate. Tropicamide is having shortest acting and action lasts for 6 hours. So these are important points. यहाँ पे cyclopentolate and tropicamide are mainly used as mydriatic agents, and here they are used to cause mydriasis. Whenever patient has meiosis, in that case, if these drugs cyclopentolate and tropicamide are given, the pupil size will increase. Meiosis means it's very small people. When these two drugs are given, what will happen? The pupil size will increase. Pupil size will increase. This is mydriatic action. Okay, and let us see some other examples. Just you try to zoom in. We have antispasmodics. In antispasmodics, we have dicyclomine. Very important drug. Just now I told. Dicyclomine, it is a tertiary amine, has antispasmodic and antiemetic properties also. Dicyclomine has antispasmodic and antiemetic. Because of these effect, dicyclomine is very effective drug for dysmenorrhea. Okay, if anybody has painful menstruation or painful menses, in that case they may have sometime emesis also. So it is having antiemetic property and also antispasmodic action. That's why dicyclomine is available, as it is very useful for dysmenorrhea. Okay, and this dicyclomine is available individually, and also it is given in combination with mefenamic acid. Mefenamic acid is the NSAID, it is combined with dicyclomine. Okay, एक combination है, we have मेफ्टाल स्पैस करके एक ड्रग वी हैव. दिस इज द वेरी फेमस ब्रांड. मेफ्टाल स्पैस हैज मेफेनेमिक एसिड and dicyclomine, which is very effective for dysmenorrhea. Okay, abdominal pain, dysmenorrhea, colic abdomen, in all those situations we can use this. किसी को abdominal pain आया तो mefenamic acid you can prescribe. And we have valethamate is again tertiary amine. It has antispasmodic effect. It is not that much used like dicyclomine, but it is having similar action like dicyclomine. We have oxybutynin, which is having same action. Oxybutynin is selective for M1 and M3. You all know what is M1 receptor and M3 receptor. M1 कहाँ है, M3 कहाँ है? It will block M1 and M3, and through that it will show the actions only, particularly on urinary bladder and salivary gland. Okay, and it also has, through M1 action and M3 action, it has vasoselective action. Okay, and we have tolterodine. Tolterodine is more selective for urinary bladder. This is important. On urinary system, if anybody has hyperactive bladder, in that cases we can use. Okay, and dryness of mouth, वो तो common ही है, which is having that side effect. And flavoxate is another drug. Dariphenacin and solifenacin, these are other drugs. They are used in hyperactive bladder, or due to M3 action they are used in bladder relieving conditions. Okay, so these are different examples of antispasmodics that can be given in GI tract as well as in urinary tract to decrease pain, or to decrease the spasms, or to decrease the overflow. If patient has diarrhea, we can go, or if anybody has overflow of urine, to stop urine we can use these drugs. Okay, so next is we have drugs which are used in peptic ulceration. So in peptic ulceration, just now I was explaining you about pirenzepine. Pirenzepine will decrease the acid secretion through M1 receptors, and it will decrease the movement of gastric and peristaltic movement. Anticholinergic side effects, it may cause dry mouth, constipation, tachycardia, ये सब हो सकता है. Benzhexol and benztropine, just now I told. Benzhexol and benztropine, these are used in Parkinsonism, याद रख लो. And glycopyrrolate, this is very important drug. It is used in pre-anesthetic agent. This is specific action. Okay, and propantheline is another drug which is used in peptic ulcerations. They will decrease the acid secretion as well as antispasmodic effect. Okay, and clidinium is another drug. Clidinium, I was telling you, this is used in peptic ulcer as well. Quaternary ammonium compound has antisecretory and antispasmodic properties. Okay, and hyoscine butyl bromide, this is semisynthetic form. Actually ये ज़्यादा यूज़ नहीं करते, but okay, in some conditions we can use. It is available as parenteral administration as well as oral administration. It is having antispasmodic as well as esophageal. GI related colic conditions में we will use hyoscine butyl bromide. Okay, so these are different examples. Now let us try to see the common uses of atropine as well as atropine derivatives. Just now atropine and atropine derivatives के क्या है main use? Atropine का main use कौन बोलेगा? Who will tell me the use of atropine? Main use of atropine. Main use of atropine, ध्यान से सुनो सब लोग. Atropine is mainly used for organophosphate poisoning. In organophosphate poisoning, Atropine is the antidote. Very, very important. Actually, organophosphate compounds are those drugs which will, when organophosphate compounds are taken, actually organophosphate compounds are pesticides. अगर कोई फार्मर या कोई बंदा पेस्टिसाइड दिस ऑर्गेनोफॉस्फेट खा लिया, if they ingest this organophosphate compound, what will happen? Just previously I explained, cholinergic drug, organophosphates are cholinergic drugs. When these drugs are taken, acetylcholinesterase enzyme is irreversibly blocked, and when this enzyme blocked, what happened? More amount of acetylcholine increases in the body. When acetylcholine increases in the body, what happens? Patient will have all cholinergic actions, muscarinic and nicotinic, particularly muscarinic M1, M2, M3, M4, and 5. All muscarinic and nicotinic actions will increase rapidly. So in this condition, atropine is given. Atropine what does? Atropine will block the muscarinic actions and it will stop all the cholinergic actions in the body, and through that it will save the patient. Especially, just I was explaining, M3 receptor on bronchioles, if acetylcholine increases, what happens? It will cause bronchoconstriction and it will cause shortness of breath and patient will die. In OP poisoning, patient will die because of this action. So immediately when atropine given, what it does? It will relax the bronchial smooth muscles and it will save the patient. Along with that, other all actions, diarrhea रहता है, patient will have urination. So all those actions will be stopped by atropine. So atropine organophosphate poisoning is very, very important use. Next, one is OP poisoning. Number two, it is, atropine and atropine derivatives are used as vagolytic agents. Vagolytic agents. You know what is vagolytic agent? Anybody from the class? See, vagus nerve is innervated into the heart. Okay. So when atropine is given, these actions of acetylcholine will be decreased. Through that, what will happen? It actually it is used in systolic bradycardia. Actually in bradycardia it is used. Bradycardia. किसी को bradycardia है तो vagolytic effect, it will save the patient by increasing heart rate. Simple. That is second action. Third action, anticholinergic drugs are very much useful in Parkinsonism. BBB, benzhexol, benztropine, biperidine. Okay, याद रख लो. Fourth use, they are used in urinary incontinence. Urinary patient को, see, usually in urinary tract infections, or if anybody has benign prostatic hyperplasia, or if anybody has any urinary related disorders, urine बार बार निकलते रहता. Patient can't stop urination. That is called urinary incontinence. Patient will have frequency. Patient will have urgency. So in this condition also, atropine derivatives can be used. Okay. And fifth one, it is used as antispasmodics. Just now we discussed. Dicyclomine is very important. Next, they are useful in asthma and COPD. Very, very important. Ipratropium bromide and tiotropium bromide. Okay. And they are also used as pre-anesthetic agent. Actually, when anesthesia is given, patient will have production of saliva, and this saliva is sometimes it will enter into the trachea and it may cause aspirations. So to decrease the saliva, in pre-anesthetic agent we use glycopyrrolate. So this glycopyrrolate is used as pre-anesthetic agent. So pre-anesthetic agent is another use. And sometimes you see, everybody listen carefully, there is a condition called cyolaria. That means excess salivation. So in excess salivation conditions, when atropine or atropine derivatives are given, what happens? Saliva will be decreased. Okay. So these are different uses of atropine or atropine derivatives in the hospitals. And in natural alkaloids, we missed about scopolamine. मिस हो कर दिया अपन. ओके, atropine के बारे में पूरा पढ़ लिए. Scopolamine. Actually, scopolamine is also having same actions like atropine, but here one important point you have to remember. Scopolamine transdermal patches करके आते हैं. Transdermal patches. So these transdermal patches of scopolamine are used in motion sickness. अगर किसी को motion sickness है, before starting the journey, scopolamine transdermal patch एक लगा लो, तो we can prevent the motion sickness in the patient. Clear? So this is the final point about anticholinergic drugs. I think और इसमें बहुत सारी चीज़ें हैं और पता नहीं क्या, but okay. So these are, till now we have discussed about cholinergic drugs, anticholinergic drugs, and antimuscarinic drugs. In next class, what we will do? In next class, we will discuss about NN blockers, nicotinic NN blockers, and also NM blockers. NM blockers. Neuromuscular junction blockers are very, very, very important. This one is little bit confusing in the textbook. If you listen my class, it will be very easy for you. Okay, so this is very, very important, and hospitals में इसका use भी बहुत ज़्यादा है. So in next class we'll discuss about NM receptor blockers. Okay, we'll quit the class here.